Migraines are known for their debilitating pain and sporadic nature, often leaving patients sensitive to light and sound. In this post-pandemic era, migraines have increased, impeding on people's lives, especially those who are older.
Well, migraine is a complicated condition, but most people think of it as a really bad headache. Most people remember having headaches when they're younger or after drinking too much, and that's a migraine. But migraine can manifest without any headache, actually. You can have 5 different migraines in the same head. And so patients have to realize that actually some unusual symptoms can present as migraine. They can think they have a sinus infection, but there's no color drainage. They can think they have an ear infection, but their hearing's normal. They think they may have vertigo, but they don't have any ear symptoms. So they get diagnosed by their primary care doctor as something else, but actually they have a migraine. So I went back to the neurologic literature and I realized they were doing a technique that we probably could do as well, but have never tried. It's where we actually put lidocaine in the nose to access basically the neural circuit board to turn off the on button to the front of the face and the sinuses. And when that happens, the migraine goes away within 10 minutes. The thing about these blocks, they work really well, but patients can't get them because the insurance company requires them to usually jump through a lot of hoops. But what I found is that I can duplicate that same technique using stuff we have laying around the office, just some lidocaine and cotton. So I started doing these about 3 years ago, and they give a diagnosis in 10 minutes. It's pretty impressive when a patient walks in with a headache or something else that they don't think is a migraine and they walk out without one.
Migraines are a common health condition, affecting 1 in every 5 women and 1 in every 15 men, yet they are not recognized as such. This is because they can manifest in ways where headache is not the predominant symptom and mimic other conditions.
We had checked everything, the MRIs, the CAT scans, everything was negative, and so I was at a point where, as a physician and as a husband, watching my wife go through all this pain and not being able to have an answer for it, it humbles you, it makes you feel sometimes helpless. But I met Dr. Abrams and he said, I think I know what this is. And I was like, well, what do you think it is? Because it's not an ear infection, because it's not getting better with antibiotics. And he says, you know what, I think it's a migraine.
And I said, sir, I don't have migraines. I don't have headaches. And so sure enough, took me into a room, cotton balls with lidocaine. Within about 6 minutes of them doing it, my ears popped open. No pressure, no pain to the touch behind the ear. Everything was completely clear and fine.
With many suffering migraines derived naturally or from long COVID, clinicians turn to novel approaches to help ease symptoms. Charlotte Eye, Ear, Nose, and Throat Associates are bringing innovative ideas to migraine treatment. Propelled by the need to end the cycle of misdiagnosed patients, doctors like Mark Abrams developed a new approach to migraine diagnosis and treatment.
For me, my migraines are pretty severe. I get an aura, so what that means is I lose my vision entirely. My arm will go numb, and the pain is just horrendous. I am in the medical field and I take care of patients daily. So for me, I can't do my job when I have a migraine. My migraines had gotten so out of control that I would essentially have to just lay down until they went away. With Dr. Abrams, I went in there. It immediately went away. I had an aura actually while I was in his office. I had no vision, and when he placed the block, it went away immediately, which was really nice. And then my block actually lasted a year. So it's being able to go out to dinner, go outside, and not have to worry about a migraine potentially ruining my day.
I was always taking over-the-counter medicines, even prescribed medicines, which some helped but some didn't. Having this procedure done, it just like, it clears everything where you can be that person again, you know, to be that dad, to be that husband, to be that provider, and that's why we do it.
Charlotte Eye, Ear, Nose, and Throat Associates is utilizing a novel approach to migraines in the field of otolaryngology. The modified anesthetic neuroblock treatment offers a quick, comfortable, and highly effective way to diagnose and treat migraines.
So my first patient was really fun. She was a lady that came in, 25-year-old neurophysiologist. She came in with the dark sunglasses with a dramatic migraine. She was hoping it was a sinus infection I could treat. Of course, I scoped her and scanned her, all negative. And so I said, I think we could probably do a block, and she begged me to, because she says, I bet you can do this. 5 minutes later into it, she whipped the sunglasses off and said, my headache's completely gone. This is the best block I've ever had. Can you do my blocks from now on? At that point, we both looked at each other and said, holy cow, this really works. This block can be used as a non-invasive, easy access technique. There's no injection, there's no bleeding, there's no pain. It takes 10 minutes and you're better for 3 months.
To learn more about this approach to migraine relief, visit www.CEENTA.com.